Hi everyone, it's Christine Espinosa, and my presentation is titled Fertility and Preconception Care for the Transgender Male with Consideration for Gender-Affirming Hormone Therapy, Testosterone. The term transgender will be used to encompass individuals who identify as transgender, gender diverse, or genderqueer, and I wanted to recognize and respect the broad range of personal identities and preferences regarding terminology, but we will mostly be using the term transgender. I also wanted to add that this field is not deeply studied yet, and this presentation was created with the currently available evidence, but I thought it was a very important aspect of transgender care to cover. So I wanted to start with some terminology. Most importantly, transgender, and we will also use trans, is a person whose gender identity is different from the sex they were assigned at birth. So that's a huge distinction. Transgender male, which we will be focusing on, has a male gender identity and was assigned female at birth. Cisgender is a person whose gender identity aligns with those typically associated with the sex they were assigned at birth. Gender identity is how a person feels or sees themselves out in the world in regards to gender. It does not always align with their sex assigned at birth. And then sex is assigned at birth in relation to chromosomes or gonads. Gender dysphoria is a significant distress or discomfort due to a misalignment between one's gender identity and the sex they were assigned at birth. And sexual orientation has to do with the sexual attraction for the person. It's not related to gender identity, and sexual orientation should be labeled by the individual themselves. Educating ourselves as providers is key, and some important terminology in addition to this to be familiar with is gender expression, gender nonconforming, non-binary, gender fluid, and TGNC, which is going to stand for transgender and gender nonconforming. So there are 1.4 million transgender Americans. The transgender community suffers poor health outcomes and healthcare disparities. Some of the top poor health outcomes include increased mental health issues, increased substance abuse issues, obesity, chronic pain, and physical disabilities. And most disheartening of all is the lack of safe and comprehensive care that the transgender population receives. Studies have shown that up to 33% do not seek care at all, medical care, due to the fear of stigmatization, and up to 25% have experienced discrimination or straight up refusal of care by providers. There's also a huge lack of knowledge in the provider community for the transgender population. So when we have transgender male patients that are interested in having families, we can talk to them about, do you desire pregnancy now or in the future? Well care for transgender male patients should include fertility awareness and assessment of their desires to conceive. Rates of the desire for parenthood in the trans community are comparable to the cisgender community. Up to 58% of transgender folks desire to have children at some point. Reported pregnancy rates among trans men are fairly low, 5 to 17% in the studies available. And this is a really important place where in our counseling and in our education for our patients, we should not assume what kind of sexual activity they're having, and we should not assume their fertility goals. It's really important to fully assess what is important to our patients and what they are living. Next, in preconception counseling, we discuss the risks and benefits of gender-affirming hormone therapy, specifically testosterone, in the perinatal period. To educate our patients about the effects of testosterone on a pregnancy. So it is a teratogenic medication, category X for pregnancy, and testosterone can have androgenic effects on a fetus. So we recommend cessation of testosterone therapy before trying to conceive. This is not always possible if it's an unintended pregnancy or unplanned, but these are the risks that we need to discuss with our patients. We also need to discuss the gender dysphoric effects of a cessation of testosterone. Gender dysphoria is a huge issue, commonly the reason why our patients seek to have gender-affirming hormone therapy. So it's a really important part of this process to discuss. And testosterone is excreted in human milk in small amounts. The risks are fairly unknown, but this has been studied. So what are family building options for our trans male patients? Fertility preservation is a huge opportunity for any transgender patient to help them plan for the future if they desire to have children. Oocyte, oocyte cryopreservation is a great option for trans male patients who later wish to carry a pregnancy or have a partner carry a pregnancy. The use of testosterone has not shown to negatively affect the success rate of oocyte retrieval. And there's low rates of use of this family building option in the trans community because they are not aware of it. Around 5 to 15% of trans community members have used this option, but studies have showed that 38% of them would have considered fertility preservation, but they were never offered or educated on it. This highlights a huge knowledge gap for providers who are not aware or not able to provide this option for their patients. Another option is assisted reproductive technology, IVF or reciprocal IVF, where the partner can carry the egg of the other partner, and they can also use donor egg and sperm. Surrogacy is an option, adoption, and then penis to vagina intercourse to create that pregnancy. So if a trans male patient is presenting to us and they are interested in fertility, they are interested in having a child, what kinds of anticipatory guidance can we give them? So in addition to routine anticipatory guidance that we would present to our cisgender patients, these topics are also very important to cover. Number one, pregnancy can enhance gender dysphoria. It's something to help them prepare mentally or find out if they're even prepared to kind of confront this. There's weight gain, the swelling in the breast tissue, the essential feeling of being in a female state, a pregnant state, and fears and worries of being seen in the world as a pregnant man, in addition to the stigma that they may already feel. This process is very heavy and mentally, and it's good to prepare them for things that they may experience. Lactation is a great topic to cover. Does our patient have a mastectomy or top surgery? Are they planning on breastfeeding or chest feeding? We would ask them what kind of terminology they would prefer we use. Lactation in general, um, will they want to suppress lactation with D2 receptor agonists? What is their plan? Kind of talk them through their options. Next is discuss pregnancy and childbirth. What are their birth options? Do they want to have a vaginal delivery? Do they want to have a C-section? Vaginal deliveries have been shown to more so increase gender dysphoria for trans male patients, and some of them do opt for a cesarean section scheduled. Are there fears for exposures in vaginal exams or at clinic? Do they prefer an abdominal ultrasound when available versus a vaginal ultrasound? And talk to them about their perinatal mental health. They are at increased risk for perinatal mental health issues. Postpartum topics can include hormonal changes that will come with the pregnancy and postpartum. Like I said, they're at increased risk for postpartum mental health concerns. We can talk to them about a timeline for resuming testosterone. Are they planning on lactation afterwards, or can they resume fairly quickly? Can also cover their role and identity changes. What do they want to be known as? Do they want to be known as a father? Are they feeling more maternal? Talk to them about what they're experiencing. And then resuming testosterone, there's no exact timeline. 6 weeks postpartum has been linked to be the best time because of the hypercoagulability, the state during that postpartum period. Are they chest feeding? Are they breastfeeding? And when is the best time going to be for them to resume this? So the ACNM position statement on the healthcare for transgender and gender non-binary people highlights safe, comprehensive, culturally responsive, and respectful healthcare. This is really our position for care for anyone. The trans male patients that may seek care with us deserve all of this. They deserve a provider who wants to learn more, wants to help them, wants to treat them. And if you are not in that camp, you can also refer them to someone. And that is an important part of our care too. If we are not able to provide that care, just referring them to a place where they'll be safe is the best thing you can do in that moment. So our main takeaways: educate ourselves as providers and educate our patients on their options, risks, and benefits for conception, for family planning, for use of gender-affirming hormone therapy previous to this process and afterwards. Learn the appropriate terminology and language when addressing our patients. Know your available resources and provide patients with helpful resources as well. Advocate for your patients and provide safe care, supporting patients throughout their journey and with their decisions. And when we hit a wall or we're not able to provide that care, refer to an appropriate LGBTQIA+ friendly resource or provider to help them. And then interdisciplinary team members should be part of our care team. We can have different specialties helping us guide this patient and provide them the best possible outcome. Make changes in your practice to feature inclusive language, handouts, and create an inclusive environment. And open communication with patients is the most important part of this. Evaluate their knowledge, their goals, and their healthcare desires. That's a crucial part of care. Communicating risks, benefits, and their choices, and providing informed consent is another pillar of care. These are some great resources I wanted to provide. TransLine is an e-consultation service for healthcare providers. WPATH is the World Professional Association of Transgender Health. and University of California at San Francisco has an established transgender care medical center with great guidelines. These are my resources.